Hello, everyone. My name is Parus, and I'm a transgender man. And I welcome you to this amazing and brand new episode of Tea Talks powered by Transgender India. Today, we have a very special guest and an amazing guest, Dr. Debmalya Sanyal. Please welcome Dr. Debmalya Sanyal.
Thank you for the kind invitation.
Thank you, Doctor. So let's begin with the first question. Good evening, Doctor. Would you like to introduce yourself and the work you do for the transgender community? And if a trans person needs to consult you, how would they consult you and what is your consultation fees?
Yes, I am an endocrinologist by profession. I have been practicing endocrinology for more than 17, 18 years and have been dealing with trying to help people with the gender incongruence and non-binary as well for the last 17 years. And it has been a growing experience, which has been quite enriching as well, trying to handhold through this transgender people and their issues through over the last 15, 16 years. Involved mainly with care and especially endocrine care, as well as coordinating the care. Also, this year from also spreading messages, awareness among, different stratas of society. I've been able to organize last year an interactive meeting, especially among different professionals like legal profession, our different medical fraternities, as well as the transgender community. And have also recently have had experience in St. Xavier's College, Kolkata, with interacting with students. And quite recently on 24th of this month, I also have been taken up the responsibility of as president of Indian Transgender, this IPATH, which is a part of WPATH, IPATH Society, Transgender Society, as president of Indian Transgender Society. So spreading the message, awareness, and trying to improve care and lives of people, especially transgender people.
Amazing work done, Doctor, and you're doing amazing. And congratulations from being the president of IPATH. We are really happy, and congratulations from the team. The connected question was, if a trans person wants to contact you, how will they contact you and what is your consultation fees?
Yeah, again for contact, you can, there are, I sit in RN Tagore, NH Care, NH RN Tagore Hospital, as well as my private clinic, also do online consultation. One can contact at my two phone numbers. One is the phone number which I'm currently connecting, that is 98301-18388. Another is through my personal chamber, that is 98362549098. So they can also do online consultation as well by through the health clicks as well. So I do my online consultation across India, and they can connect. So generally, it depends on the hospital which I'm attached to, because those hospitals have their individual fee structure. With regards to my personal clinic, it's around 800 rupees. But for the hospitals, they have their individual fee structure. Thank you.
Thank you so much, Doctor. This is amazing. So you can contact doctor from his number and through his hospital also. And I think let's move on to the next question.
Yes.
So how does long-term testosterone HRT impact bone density in trans men? This is the first question of the day.
So if you see that, we require hormone therapy, because whether it is cis people, whether they are male or female, they require the sex hormone to maintain the bone health. And especially if the transgender people are on regular therapy at a proper dose, which is similar, and they achieve the hormonal level to their desired sex. Like a transgender man has the testosterone level in the range of a cisgender man, and he maintains the treatment regularly, does not discontinue the treatment, then the bone health is not impacted. So what is seen is that in patients who are regular with their treatment, and not only that, treatment should be optimal, not suboptimal. That is proper dose to maintain the levels within the normal cisgender range. If one should not also not exceed the dose, because there can be side effects like increase in hemoglobin, that is erythrocytosis, and other problems. But if it is within the range, then there is no impact on bone health. The problem comes in when people discontinue treatment, when they're irregular with treatment and they don't come back for follow-up, where the levels of the hormone dip, and that's when the bone health is impacted. And also people who go for surgery, they think that everything is done and over, but you need to continue the medications, especially for transgender men, as long as possible, and adjust treatment.
Now, I want to ask you, doctor, what will happen if we are irregular with the testosterone therapy? What will happen to the bone health then?
So again, with regards to bone health, especially the sex hormones maintain the bone health primarily in the vertebra, that is our spine, our femur bones, that is long bones, which is also impacted, as well as to the some extent radius and overall bone mineral density. Okay, so there are two important aspects to bone health. One is the bone density, and the other part, and that also includes the calcium as well, and other hormones like vitamin D, which is also a hormone, and that maintains the, apart from the sex hormone, there is a role of thyroid hormone. Initial period, there is also a role of growth hormone. So what happens is, if they discontinue therapy, either male hormone or female hormone, actually the male hormone is converted to some extent in the bones as well to the female hormone, to estrogen, and that impacts the bone. So if there is absolutely no hormone or inadequate amount of hormone, we are always having bone is being formed, and at the same time bone is being reabsorbed. So this balance between formation and reabsorption is very important. When the hormonal levels fall, the reabsorption, that is bone loss, becomes more than the bone formation. So then your bone starts getting weaker, and you have a higher chance of sustaining a fracture if your hormone levels are not maintained in the adequate range.
Thank you so much, doctor. And thank you so much for explaining it well. So, always to all the trans people watching this, please take your hormones on time. Don't miss your dosage. It's very important for your bone health. Otherwise, your spine and your other parts of the bone can get affected.
And
So,
also it is
let's
very important to monitor the hormonal levels as well, so that they are in adequate quantity. Otherwise, if they are inadequate also, they are also going to be a problem.
exactly. So take your hormones on time and take it adequately, and don't and always keep on checking up with your endocrinologist. So thank you so much, doctor. And let's move on to the next question. What are the recommended intervals for bone density testing during testosterone HRT? If yes, then at what intervals?
So again, if you think of it, if the recommendations are, there is no specific mandatory recommendation that you need to do regularly the bone health. Of course, it's going to be good if you have a baseline before starting treatment for transgender cross hormone therapy, or before starting treatment. Then we have a baseline. When you are just starting your gender reaffirmation hormone therapy, it's good to have a baseline bone mineral density DEXA scan. Then you will know where you are starting from. the baseline. So whether you are going up or you are going down. So what happens in trans men is that, men generally have a higher bone mineral density than women. But trans men actually fall, what has been seen, somewhere in between cis men and cis women. So it is somewhere in between. It is more than a cis woman, but somewhat less than a cis man. So there are recommendations that probably we should take the value which is intermediate between a man and a woman, and that is how it should be done. But we need to it is not mandatory to have a baseline BMD, but it's going to be useful if we have to do a future comparison. But generally, routinely, one need not repeat. If a person, as I had told you, is taking the medications regularly, if the hormones are maintained properly, if after surgery the hormones are started right away after surgery, there is minimal impact on bone health. But if the patient is irregular with treatment, has stopped medication, especially after surgery, once the ovaries are removed for a trans man, and then there is no hormone like no estrogen or testosterone in adequate quantity, then and the patient is also not getting the hormones from outside, then there is a chance of bone loss and sustaining a fracture. Then one should go for a bone mineral density testing. And if you want to know how frequently, so once you have done it, one should start treatment with adequate amount of hormones, and it should not be repeated before 1.5 years. Generally, it is said we need to repeat after 1.5 to 2 years.
Now, I have another question. If we get surgery done, we'll be immobile for a while. For during that time, for how long I should stop my testosterone and when should I start again?
Well, again, if you see, this is more of a concern with trans women where you are taking estrogen, because that increases the risk of uh, venous thrombosis and pulmonary embolism. That is venous thrombosis, clot in your veins. But again, with testosterone therapy, there is no such recommendation that you need to stop testosterone after operation. So you can actually start away with testosterone therapy. You can actually continue prior to that and start hormone therapy when you are reasonably fit. Within 1 to 2 weeks. There are some people, some organization which suggest about 2 weeks after post-op. But you can generally, that is the interval, especially if the patients are on injection, which is the most common form of testosterone therapy. Even the gels can be used right away after surgery, say after 2 weeks of surgery. So you need not be off therapy for long term when we are taking testosterone. Obviously, if you are taking estrogen, then your chances of venous thromboembolism is somewhat higher. So unless you are mobile, you are up and walking, you should be avoiding taking the estrogen. But for trans men, that's not a major problem. One can start taking testosterone, because if the hormones, the ovary is removed and you are not having hormone again, the feeling of gender dysphoria or uncomfort would also increase. So you can start right away taking taking testosterone after surgery.
Not only hysterectomy, but also top surgery, right?
Yeah, absolutely. Actually, for top surgery, you don't require any discontinuation. Even for bottom, it's not that mandatory. For men, trans men. For trans women, one should be stopping it preferably 3 to 4 weeks prior to surgery and 4 weeks post-op till the patient is mobile.
Okay.
The estrogen.
So, as you have heard, we trans men can start HRT straight after our surgery. It's not mandatory for us to stop it for a while. And as doctor said, we have to be regular with our hormones. We have to keep on taking it on time, and the hormone levels should be adequate so that our bone's density is normal. So, thank you, doctor. Let's move on to the next question. How can trans men ensure an adequate intake of calcium and vitamin D to support bone health while on testosterone HRT?
So again, what is the issue is that the current recommendations are to maintain an adequate level of vitamin D, and calcium should be from dietary calcium. The issue is with vitamin D is because of our in our part of the world, because of our pigmented skin, sunlight exposure, vitamin D level, adequate vitamin D level cannot be achieved in most people with sunlight exposure, because that the time of the day it should be in the noon, and upper torso should be exposed for at least quite some time during that time, which is almost impossible for majority of people other than people who are working in the fields. So that's very difficult. So most of us are vitamin D deficient. So we need to monitor the vitamin D levels, and you have to have adequate vitamin D levels, which is more than 30 nanograms per DL. We can, if most will be deficient, so we need to have a 8 or 10 weeks course of weekly vitamin D oral. The injectables are not recommended because there is a fluctuation in the levels. So 60,000 units once a week for 8 weeks if the level is less than 30. And then maintenance dose, which is very vital, monthly maintenance dose of 60,000 units to maintain an adequate amount of vitamin D, because vitamin D is the hormone which increases the calcium absorption from your food. So unless you have vitamin D, in spite of taking calcium, it will not go into your bones and body. So the calcium ideally should be from your diet, which includes, especially milk is a very good form. In any form, milk is very good form of dietary calcium, and other foods as well. So that is adequate. If there is inadequate calcium intake, then one can go for calcium supplements. The calcium supplements should be around 1,000 to 1,200 milligrams per day. The vitamin D minimum should be 800 international units per day, but preferably 2,000 international units per day, the maintenance dose. That's why we recommend a 60,000 units vitamin D once a month, one dose. And adequate dietary calcium intake, if that is not there, with dietary assessment, one can go for a calcium supplementation, which can be between 500 to 1,000 milligrams per day.
Okay. Thank you so much, doctor. And take your medications on time. And it's very important to take vitamin D so that your calcium gets absorbed in your bone.
So
And
again, you take the vitamin D which you are having. If it is a fat soluble, if it is in some formulations can be taken irrespective of meal with water, which is a water soluble formulations which are there, which are liquid formulations which are better absorbed, which you can take any time of the meal. But most of them you need to take it after meals.
okay. Yes, doctor. And most of them after dinner or maybe after.
Yeah, and a little bit of a fatty food. After that, the absorption improves because these are fat soluble vitamins.
Sure. Thank you so much, doctor. And let's move on to the next question. So, how does testosterone influence bone remodeling, and what does this mean for bone health in trans men?
So again, testosterone directly or indirectly through estrogen improves the bone formation, and most importantly, inhibits the bone resorption, that is bone loss, which is a continuous process of formation and resorption. So the balance remains. If there is inadequate amount of testosterone or inadequate amount of hormones in the body, then the bone loss or resorption takes the upper hand, and bone beyond more than bone formation, and then the bone there is gradual bone loss, which leads to weakening of the bone and increased risk of fracture.
Okay, doctor. So that's why it's very important to take your medication on time and keep on checking up with your endocrinologist. And let's move on to the next question. Are there any specific areas of the skeleton more affected by testosterone induced changes? I think we talked about the spine, but are there any more other parts of the bone which are more affected by testosterone?
Yeah, mainly the sex hormones have a very important impact. One is on the spine, second is on the long bones, especially the femur bone, the neck of the femur, where you have the fracture, the femur fracture, which is a dreaded complication, especially if one sustains a femur fracture. There can be multiple vertebral fracture. There can be fracture in the wrist, what is also known as the Colles fracture, which can also occur because of inadequate amount of sex hormones. So these are the most vulnerable sites of the body: the spine, the femur, the long bones, and especially also the wrist.
Okay, doctor, thank you so much. And there is this something related to exercise. What role does regular exercise, particularly weight bearing activities like strength training, play in maintaining bone health during testosterone HRT? We often, as trans men, we want a more masculine body. So most of us go for strength training. So what does, and also sometimes cardio also. So exercises like cardio and strength training, or maybe a combination of both. What is the role that they play in the bone maintenance in testosterone HRT?
Yeah, one of the most important reasons why people sustain fracture is, apart from bone loss, is because of the fall, risk of fall. And one of the main reasons why people sustain fall is because of muscular weakness. Now, if you have the strength training exercise, whether it is a resistance exercise or even aerobic exercise, especially with resistance exercises, it is even better, but that has to be done at an interval. And so that can lead to a better muscle mass, and that can decrease the risk of fall and decrease the risk of sustaining a fracture as well. And again, there is data to suggest that, even strength training exercises may be helpful in terms of bone accrual, especially with regards to bone formation, and during adolescence and early adulthood, up to 30 years. By 30 years, generally, we attain the peak bone mass. So attaining the peak bone mass is also helped by exercise, and also by maintaining. Exercise also helps in maintaining bone mass as well.
Thank you so much, doctor. So everyone listening to us, all the trans men listening to us, if you're on testosterone, if you are doing strength training, it will add more to your bone strength and your bone density.
But always do under guidance, not unguided.
So always do it under guidance. I think don't do too much. Just do the adequate amount.
So adequate
So,
rest is also very important. Otherwise, there can be muscle injury.
okay. So adequate weight is also important as
Weight
doctors.
and rest interval. Interval is also very important.
Yes. So intervals, take breaks between you workout. Don't do just okay. I've done this rep. I've done this set. I'll do another one, and I'll go and take a break. That is gonna harm your bone a lot. So take breaks in between and take the right. Keep your weights light. You don't have to flex with someone. So take your time. But yeah, if you are doing strength training under guidance and support, it will be very good for your bone. But do you recommend any exercises for bone health in strength training?
Well, basically, the recommendation is any form of aerobic exercise, which includes running, jogging, cycling, swimming, or brisk walking, and at least which should be about 150 minutes per week, 5 days, at least 5 days a week, without a gap for more than 24 hours. And again, resistance training exercise, um, at least 3 days a week, uh, at, if possible, 30 minutes. But again, gradually that has to be increased under supervision. So both resistance as well as aerobic exercise are important.
Okay, thank you so much, doctor. Now, the next question is, this is a myth actually, but I want to hear from you that how do you debunk it? Like, many people are saying from the community that testosterone will affect your bone density in a negative manner. What's your take on that?
So again, you must understand that in men, we have the testosterone to maintain our bone health, which actually gets converted to estrogen in the local sites like in the bone. We have a hormone enzyme which converts the testosterone to estrogen in the bone. That's very, very important to understand. Even in the bone, our body's testosterone in a man is converted at the local bone site into estrogen. So that acts on the bone, that primarily acts on the bone to maintain the bone health. There is some role of testosterone directly as well, but primarily it is through the estrogen, even in men. So that is something very important to understand. And if you see, if you generally see, uh, uh, in a adult man versus an adult, even in the BMD reports, you can see bone mineral density. It is divided on the basis of sex apart from age. So the a man's BMD is actually higher than a woman's BMD. And if you see between a transgender man who was a cisgender woman who has become a transgender man, his bone health, his bone mineral density is actually somewhat more than his cisgender, original cisgender women's bone health, but it is not as high as a normal as a cisgender man. As a, not I wouldn't be saying normal, but a cisgender man. So it is slightly less than a cisgender man, but more than a cisgender women, somewhat in between. And this also applies, this is also true for a trans women, where the bone health is somewhat less than a trans the cis man, which the person was initially, and it is more than the cis woman which the person is living.
Thank you so much, doctor. And let's move on to the next question. Are there any supplements aside from calcium and vitamin D that may be beneficial for bone health during testosterone HRT? We can talk about dietary recommendations, or are there any things?
So again, what we need to be important is the right amount of balanced diet, which includes vegetable, fruits, minerals, and adequate amount of protein intake is also essential for bone health as well. So uh, you need to have a good amount of, apart from calcium, vitamin D, uh, other minerals like phosphorus and other minerals intake. You need to have a good amount of protein intake as well, adequate amount of protein intake as well, as per recommendations for maintaining good health and also for maintaining muscle mass. Because if you do not have adequate muscle mass, that would also impact your bone health as well and increase the risk of fracture. So intake of protein and having a right balanced diet is very important. Even if you have excess salt as well, that can cause bone loss because of high salt content in your diet. So that also we need to be careful about, and maintaining adequate calcium and vitamin D. There is no such specific supplement which is required.
Okay. Are there any dietary recommendations for calcium, increasing calcium? Like we have milk.
Yeah. As we have said, the adequate calcium should be 1,000 to 1,200 milligrams per day through diet, and that should be through dietary calcium, and this should be facilitated by along with an adequate amount of vitamin D. If there is inadequate calcium intake from diet, then one can supplement it with calcium tablets as well, but preferably to use dietary sources of calcium. There is unfortunately no dietary source of vitamin D. There are some foods which are fortified with vitamin D, like cheese, milk.
Okay. Thank you so much, doctor. And yeah, I think egg whites are a good source of protein and calcium both, right?
Yeah,
So we
yeah.
can add that also. So you don't have to go for synthetic protein. You can just take natural sources of protein and natural sources of calcium. And vitamin D is a medication which will be provided to you. So take care of your diet. I think that's all. That's what the doctor wants to say. And let's move on to the next question. So, what about bone marrow density and what role does it play in the bone density under testosterone HRT?
Yeah, the bone density, as I said, the bone marrow contains blood cells. So bone marrow, what happens is if you take testosterone, there is a rise in the red blood cell corpus, RBCs. So what happens is then you have an increased chance of, if the RBC is high, especially in patients who have a prior history of asthma, who are smokers, there is a chance of if the patient is smoking or is having asthma, then automatically the red blood cell numbers are high, the hemoglobin is raised. And so, if you take testosterone on top of that, there is a chance of hypercoagulability because your blood's RBC amount increases, and then the chances of clotting increases as well. And with regards to bone mineral density, that's separate. That is the bone mineral content, which is actually impacted positively by testosterone therapy. It is actually absence of any sex hormones, which I was saying, which negatively impacts the bone mineral content.
Thank you so much, doctor. Now, a question connected to this. How does smoking and alcohol consumption impact bone health in trans men on testosterone HRT?
So if you see, when we are assessing for osteoporosis, there is one thing called known as the FRAC score. FRAC score. So if you see the FRAC score, where you assess the risk of fracture. So one is if you have osteoporosis, that is your bone mineral density DEXA scan. It should mind you, do always a DEXA scan. Never do the ultrasound bone mineral density which they do of your lower limb in your ankle. That's not recommended. The recommended test is doing a bone mineral density by DEXA scan. It should be done at least of femur, both sides, dual femur and spine, by DEXA scan, not by an ultrasound technique, not in the calcaneum. And what happens is the bone that assesses your fracture risk, and overall fracture risk is associated with, which is calculated by FRAC score, which not only includes your bone mineral density but other fracture factors which increase your fracture risk. That includes your age, includes some diseases like rheumatological diseases like rheumatoid arthritis, and also includes your sex, because female are more susceptible. Again, it includes medications like steroids, which increases the risk. And very important, two important thing which in worse increases your chance of fracture are your smoking and alcohol intake. Especially current smoking and current alcohol intake adversely affects your bone health.
Thank you so much, doctor. So, smoking and alcohol intake is not good for your bone health, especially your bone marrow. So, I think maybe do it. Can we do it in moderation or in a controlled way?
Well, if you see with regards to smoking, any amount of smoking is harmful with regard to your cardiovascular health and cancer. So no amount of smoking is permissible. With regards to alcohol, it has been shown that also alcohol, any amount is detrimental. But if you take alcohol, you have to take in moderation, occasional, and you can take, 1 or 2 units when you are taking the alcohol, but not more than 2 units for anyone. So that depends, what alcohol you are taking. The unit actually measures depending the alcohol you are taking.
Thank you so much, doctor. So, smoking and alcohol is not good for your bones and your bone density. So, it's very important not to do it personally. So, let's move. Thank you, doctor. And let's move on to the next question. This is related to DEXA scan. How often should trans men on testosterone HRT undergo DEXA scan to monitor bone density? And can you also talk about what are DEXA scans and how important they are for us trans men?
So DEXA scan is primarily an X-ray. It's a type of an X-ray which assesses your bone mineral content at specific sites. More importantly, it can be a whole body, but generally it assesses primarily in the spine and in your neck of femur, which is most impacted, and that causes osteoporotic fractures. Now, this is a very simple test. You do not require any injection. It's just like a simple X-ray. But what happens is, if it is possible, ideally, because it's costly, you know, it costs ranges between 2,000, 1,500 to 2,000 rupees. But ideally, if you have a baseline, at baseline before you start treatment, a bone mineral density and DEXA, it is ideal. But there is no recommendations that you have to do it mandatorily. But if there is a family history of fracture, a personal history of prior fracture, previous fracture, or the patient is high risk, like patient is smoking, having alcohol, and has been off any therapy, hormone therapy, like the patient has a lot of people come to us where they have undergone the surgery, the bottom surgery, not the top surgery, because the ovaries and the gonads, the ovaries and the testes secrete the hormones. So if that is removed and the patient is still not taking the hormones, then there is no hormone in the body. So that puts the patient at a high risk of fracture. So in such situation, of the patient is having like rheumatoid arthritis, so in such a situation, the risk of fracture is increased. One should mandatorily go for a bone mineral density testing. If possible, ideally all at baseline, and then one should follow up every 2 years to see if the bone mineral density is low. If they should be doing it every 2 years. Otherwise, one need not do it if the patient is compliant with therapy and the therapy is maintained at an adequate range. It is not necessary. If there is any discontinuation, then one need to do it immediately and see whether the bone health has been adversely affected. And once the treatment, then again they should recheck after 2 years, not before 1.5 to 2 years, because the impact of any treatment takes about 1.5 to 2 years to set in. So one should repeat after 1.5 to 2 years, 1.5 to 2 years, to see whether there has been any improvement or not.
Thank you so much, doctor. So take your medications on time. It's very important. And if you are drinking or smoking, you should go for a DEXA scan. So let's move on to the next question. How does a family history of osteoporosis or bone-related condition influence the bone health consideration for transfer on testosterone HRT?
So as we have said, that any person who has a family history of fracture or a prior history of personal history of a fracture, especially when the fracture is from a standing height, that means the patient is standing and had slipped on the floor and sustained a fracture, whether in the family or personal history, then the patient is at a higher risk of a fracture. So in such a scenario, one should be more vigilant and careful for fracture, and also do a monitoring at baseline and follow up, and also be compliant with treatment as well.
There's a question related to symptoms. What sign or symptoms should trans men be aware of that may indicate bone health issues, and when should they seek medical attention?
So again, there are important signs which are quite subtle, however. One is with regards to if there is inadequate amount of vitamin D, that also can worsen your bone health and BMD as well. So if the vitamin D and calcium is inadequate, then the BMD can be low and negatively affected. So first we need to ensure adequate amount of calcium and vitamin D. If there is inadequate amount of calcium and vitamin D, one can have osteomalacia. There you have bone pain, muscle pain, and again you can have weakness, especially what we call proximal weakness. Proximal weakness means difficulty in getting up from sitting down, lying on the floor, you are trying to get up, so you require help. Again, difficulty in picking up objects, from the height, like if you're kept in something in the cupboard, taking it down. So those are proximal weakness. getting up from the floor or picking up objects like that. So those are the signs of, along with that, bone pain and muscle pain are signs of vitamin D deficiency. In some patients who have osteoporosis, especially who have osteoporosis in the spine, there can be compression in the vertebra. So actually you can lose height, especially if there is, that can be an early sign of compressive fractures as well. So if a patient is losing height, or the patient has sustained a fracture by falling from a standing height. So patient has just slipped on the floor and sustained a fracture, that is suggestive of osteoporotic fracture, and that should be evaluated properly.
Thank you so much, doctor. So please take your hormones on time. And if you have a history of bone health issues, then please look out for these symptoms and ask for and go to the doctor immediately if you face anything. So let's move on to the next question. So this is a long-term question. What are the documented long-term effects of testosterone HRT on skeletal health in trans men? And how do these affect compared to cisgender male population? As we said, we have talked about the density is less, but what about the bone health? Like, what is the difference between the bone health of a cisgender person and a bone health of a trans person? And what are the long-term effects of taking testosterone?
So again, I would like to reassure that there are studies to show up to 10 years there is long-term, not no effect either on bone health or on cardiovascular health or on cancer up to 10 years. So the data is quite reassuring. So one, rather, if the person is not taking the hormonal therapy, the problem is more with patients who are not taking hormonal therapy, or there is inadequate amount of hormonal therapy, especially after removal of gonads like ovary and testes. So that's very important. Now, as you can understand, the testosterone levels, initially, especially people start testosterone after they achieve their adulthood or adolescence. That is the recommendation. And so by that time, they achieve their bone mass, which is the adult bone mass. So obviously they have had their hormonal exposure, whether it is male or female hormone. So in a trans man, because they have had main hormone exposure, which is estrogen, so it is more likely to be in the female range. Once they receive the testosterone therapy, then it increases to some extent. So they are more, they are higher than the female range, but not as high as a male range, normal cis male range. So it is somewhere in between. As I just said, in a trans woman, it is somewhat lower than the cis man range, and it is somewhat higher than the than a cis woman range. So it's somewhere in between the native or natal sex and the desired sex, somewhere in between.
Okay, thank you so much, doctor. And let's move on to the next question. Now, this is a question which I was thinking about, that after 30s, people who are assigned female by birth will start losing their bone density, right? How does
Actually,
this impact
both male and female do. Both male and female do. Female do it more rapidly after menopause.
Okay. So, how does this impact trans men under testosterone HRT?
So actually, that's the issue. If the person is taking HRT, that HRT in trans men can be taken right. There is no age limitation that they need to stop. Obviously, those and the formulation has to be altered, more safe formulations. But they can take it long term. Even up to 60s or 70s, because men have their testosterone level in normal range, even 60s and 70s. Lot of men. But in trans women, we generally stop therapy in the 50s, just like a normal menopause what occurs in a cis women. So that's why the osteoporosis risk increases significantly in women, cis women as well after menopause. So generally with long-term therapy, we can maintain the bone mass. So that's less of a problem in a trans man. It's more of a problem in a trans women, where we need to discontinue therapy in their 50s. Then we need to look for bone mineral density 5 years after discontinuation of estrogen. And then we need to supplement me to give additional anti-osteoporotic medication if they develop osteoporosis. But background calcium and vitamin D for all.
Thank you so much, doctor. And let's move on to the next question. This is a question related to bone health monitoring. How can collaboration between trans men, primary care physicians, and endocrinologists ensure comprehensive bone health monitoring during testosterone HR?
So again, it's very important that the physicians also ensure that adequate amount of therapy and compliance to therapy is there, and also adequate amount of calcium and vitamin D. It's a primary responsibility of the physicians to report and refer when there are problems regarding bone health, as I was mentioning, signs, symptoms, or inadequate treatment of their, or they find that the bone mineral density has gone down, or there has been a discontinuation of treatment. These are the red flag signs when one should be going for further investigations. And also, if there is a family history or a personal history, or they suffer from diseases like rheumatoid arthritis, or they are taking steroids, there one should be evaluating, and they should be referring for evaluation of bone health to an endocrinologist.
Now, another question, doctor. How do steroids affect bone health? Like if we take
So again,
steroid, yeah.
steroids have a negative impact on bone health, and they decrease bone formation as well. In long-term steroid intake, especially if it is prednisolone for more than 5 milligrams per day for more than 3 months, one should be on anti-osteoporotic medications along with adequate amount of vitamin D. So there is a high risk of osteoporosis in patients who require steroid for different purposes. Generally, steroids are not prescribed in transgender people like others. But if there are specific indications like rheumatoid arthritis or COPD or other neurological diseases which require steroids, then that is a different ball game altogether. Steroid-induced osteoporosis has to be evaluated with BMD and vitamin D and other features and should be treated adequately.
What about steroids for muscle gain? Like,
So again, it is not recommended to have steroid for muscle gain. So that is something which is not recommended. So that is commonly abused and which should be strongly discouraged.
thank you so much, doctor. You busted a lot of myths and you talked about how important our bone health is. And we shouldn't ignore it. We should take our medications on time. We should take our HRT on time. And these were the questions for today evening. Do you have something extra to share about bone health or for trans men?
So the most important message which should go down is one is that regularity of follow-up with your endocrinologist and physician is important. Do not discontinue medication without medical advice. Have the regular follow-up as has been recommended. Try to take medications regularly and also do the monitoring part as per recommendations and by your doctor. And if there is inadequacy at some point of time, then you need to go back and recheck. Especially a lot of people, after we have seen through them the initial part of the cross hormone gender therapy, people after surgery, once they go for surgery, think that everything is done and over. So that is where they are. And then after surgery, one needs to be on hormone therapy lifelong in trans men, and also long term, at least till 55 years in trans women. And then adequate follow-up for osteoporosis should be there. Do not forget your calcium and vitamin D. Do not forget good nutritious protein diet. And also do not forget, along with calcium in your diet, and do not forget your exercises as well. And
Yes.
do not smoke and take alcohol. Try to quit smoke and alcohol. That's very important from your bone health, from your overall health, from your cardiovascular health, from cancer health. For anybody, that is independent of whatever your orientation.
Yes. Thank you so much, doctor. This was very lovely advice. So, just basically take care of your health, take care of your diet, work out, and work out if you're working out, please do it under guidance. And please take care of your health. I think that's what doctor is trying to say. And thank you so much for everyone for joining in. today. And if you want to know more about transition, surgery, HRT, and more about medical, legal, social transition, then don't forget to follow Transgender India. My name is Paras, and I'll be meeting you in the next interview. तब तक के लिए धन्यवाद. Thank you. Thank you so much, Doctor.
Thank you. Thank you. Thank you. Wonderful talking to you.